Case number 3. A 79-year-old female patient who had fallen at home and got a hip fracture has been operated, and it is the 4th post-operative day. Everything is going well, and the patient has been discharged today with the help of home care. For the medication management, administer medications as per the provided schedule. Ibuprofen 400 milligrams 3 times per day. Bisoprolol 5 milligrams once per day. Paracetamol 1 gram 3 times per day. Simvastatin 40 milligrams once per day. Aspirin 50 milligrams once per day. Enoxaparin sodium 40 milligrams once per day subcutaneously, and pantoprazole 20 milligrams once per day.
So the physical assessment would, of course, we would take the vital signs, the blood pressure, the Verensokeri, temperature, and the respiratory rate on how's the patient. And we have to assess the pain level. Of course, she had gone under through a hip surgery, so we could assess her based on her pain level. And the surgical site, if it's bleeding or if it's tender, you could check it properly. And if there's any wound dressing that's been exposed, we could check on that. And her mobility, evaluate the patient's ability to move, if she's able to move, and how she could go around the room. And skin integrity, inspect for pressure ulcer or other skin breakdown. Of course, hydration and nutrition. And the functional assessment, of course, we have to check the activities of her daily living, how she's doing, and use assistive devices such as rollatory, the cane, walking cane, and other kinds of equipments if she's needed. And lastly, psychosocial assessment on how her emotional state is, especially when she had a hip injury. And and support system, of course, we're there empathetically as a nurse to be with her.
Okay. Yeah, that's a good assessment.
Yes.
Okay.
Yeah, before discharging the patient, yes, it's really important to do overall assessment.
Yeah.
So if the patient then so that the patient no need to go back to the hospital. Yeah, could be managed at home.
What's our main goal?
Yeah.
The planning,
Yes,
we need to plan.
planning.
So our main goal is to ensure that the pain is managed effectively, especially if the patient complained for pain. You need to give some pain medications, right? And prevent complications such as infections or pressure ulcers. If the patient is maybe we can turn her during sleeping, or if she's independent, of course, she can move by herself.
And because sometimes it's painful for the patient to move by themselves, yes,
Yeah,
that we can
push off.
assist, push off, yes.
So that she won't be confused, we have to educate her so that she won't be sekaising on what's happening.
Yeah, it's helpful too.
Yeah, and also it's important to provide emotional support and provide health education to the patient and the family.
Yes. Yes.
And the expected outcomes is the patient will report pain at manageable level. The surgical site will remain free from signs of infection, such as checking the wound site if there's a purulent discharge or something.
Like a pus.
Yeah. And then the patient will be able to demonstrate the safe use of assistive device, for example, rollators or canes, should she need one. She'll be able to perform activities of daily living, like picohilia after the operation. The patient and family will verbalize his understanding of discharge instructions and home care needs. Probably we can do like after the explanation, the patient or the family members can like explain to you what needs to be done. So it's ensured that they understand the instructions.
Yes.
Great.
Yeah, planning is also very important upon discharging the patient, so they have the guide to follow at home. Yes. Yeah, and moving on to interventions. So first thing first is the pain management, because the pain level is still high at this moment. It's
Yeah.
only how long was the operation was done? For
Fourth
On her
post
fourth day.
yes, fourth day, so it's still painful,
Fresh.
still
Yeah.
fresh. So, in under the pain management, the patient is given analgesics. Yes, namely ibuprofen 400 milligrams and paracetamol 1 gram. Well, that's a very good combination. I experienced that before. Paracetamol was not enough, even though it's 1 gram, so it's a very good combination together with ibuprofen, because there is still swelling. And the second one is other non-pharmacological methods such as ice packs and positioning and relaxation techniques as well. Even deep breathing, it can also helpful to the patient. And then and the next one is infection prevention. So under that, we can educate the patient and the caregivers or the family on proper wound care, because there will be no longer nurse with the patient at home, so only family members. So it should be proper, like it should be clean wound dressing.
Yeah, I think
Yeah.
it's also important that the patient and family members have the knowledge on how to do the wound care, right?
Exactly, yes. Because they are not doing that in daily basis only. Yeah, so they really have to do it properly. And also they have to monitoring the surgical site for sign of infection, because sometimes the dressing is dry. It's because the pus will be on the later stage of infection, so they have also to check the wound itself. It's really dry and not swelling and not red, so there's no sign of infection. That's a good thing to do. Prevention is better than cure. And the next one under infection prevention is encourage good hand hygiene practices. So hand washing, universal.
Yeah, before and after.
Yeah,
right?
before and after. So, and then another intervention is for mobility and safety. And under that, we can assessment to the patient with ambulation and transfer as needed, because moving is important, so the circulation will be continuously, so the wound healing will be fast.
Yeah, and the embolism can be prevented.
Embolism, yes. So move.
Yeah.
And the next one is teach the patient how to use assistive device correctly. You were mentioning this rollatory and
Walking cane.
Yes. I don't know how to use that, so patients should know how to use that, and so that the education takes in place. They should be instructed properly.
Especially when she had the hip surgery.
Exactly.
They need to have the rollatory in all
Prevent fall.
Yeah, to prevent fall.
Yes. Yeah, and in addition to that, also implement fall prevention strategies such as removing hazard and ensuring adequate lighting at home. So, bright, yes,
Yeah.
bright
And
lights.
Free of space, so she is
Yes.
able to move.
So remove
Easily.
the small things that
Sharp
can,
objects
yeah.
or
So
mat.
more spacious
Yeah.
is better. It's more better if spacious, right?
Yeah.
So he can move
Easy
freely.
access.
Yes. Yeah, and then under intervention, we can also, I mean, skincare also under intervention, we should reposition the patient regularly to prevent pressure ulcers. So because it's still painful for the patient to move by himself, so
Yeah.
support should be.
Maybe she will have like a limited movement at that
Yes,
time.
because of pain.
Yeah.
Even though the patient receiving pain reliever, it's still
Still
painful when
there.
it's
Yeah.
moved. I had that experience before, so yeah. So yeah, help from family members is important.
Or we could have this chart that we would give to the patient. So every Monday, this position would be her night position.
yes.
Wednesday, and this.
Yeah,
and
we can
those
give
kind
her
of.
instructions like that. Yeah,
Mm-hmm.
that's true. That's a good idea.
Yes, yeah. So they can keep in track of
Mhm.
the movement. And also, in addition to the skincare, we use pressure relieving devices such as cushions or mattresses. Yes, the soft,
Something soft.
The
Yes.
lima.
the softer one. So
To
yeah.
avoid pressures with
Yeah.
the operated
The
side.
surgical side.
Yeah, the surgical side.
Yes, exactly.
And then also nutrition and hydration is important. We should encourage the patient, especially she's 79-year-old female. It's good that her diet would include like rich in proteins.
Mhm.
Like so for the nutrition and hydration, of course she's post-operated. It's better if we could like encourage her to eat foods rich in proteins, vitamins and minerals to promote healing. Like what's good protein? Like meats and then eggs and what else? Vitamin rich foods, fruits and then vegetables.
Vegetables.
Yeah.
That
To
is true.
promote healing.
Yeah. Sometimes they could also buy from apteki the Nutri-Drink to have
yeah.
that, or Cubitan,
Yeah.
so that it would have a faster healing on the
Yeah.
wound.
Yeah, that's true because maybe she's post-op, she doesn't feel like, especially
Eating.
Yes.
She doesn't have the
the
Appetite yet.
appetite to eat.
Mm-mm.
And then of course the adequate fluid intake. Yeah, the one you mentioned,
Mm.
Nutri-Drink, it's good because as we all know, old people, especially senior ones, they don't like,
To
they
eat.
have poor nutrition
Mhm.
usually.
Mm-hmm.
Yeah, they easily get weight loss fast.
Yes.
Yeah. And then, of course, education and support. We should provide education on medication management, the wound care, and the signs of complications for the wound. For example, if it's still swelling, even though it's been many days, and then there's redness, and it feels sore, what do you call that? What else are the signs of
Signs of
infection?
like, it's like hot, like
Yes,
Hot,
hot,
yeah.
yes. Mm-hmm.
We should encourage her to report back to us.
Yes.
or
Yes.
call the
Call
nurse,
the
right?
nurse, yeah.
Mhm.
And then, not also on the patient, we should also inform the relatives who takes care
Yeah.
of her. And then, how to properly cover the wound. When she's at home, should always encourage the hand hygiene.
Hand
Yes.
hygiene, back to the hand
The April
hygiene,
mentioned a
yes.
while ago. And then, we should also offer emotional support and address any concerns or fear, especially she's post-operated. Normally, old people are prone to loneliness,
Mhm.
more
And
lonely,
fearful.
and fear. And then since she had surgery, there could be like a feeling of disturbed body image.
Yes.
Yeah.
Yes.
Should tell her that it's
Yeah.
normal and it will heal soon if she follows the proper instruction.
Yes.
In addition to that, because everyone knows that when you're a person getting older, it's also slower the healing is.
Yeah.
So that's also contribute that the patient might feel lonely and anxiety. So yeah, emotional support is important to the part. Yes.
Yeah. And then connect the patient and family with community resources or support groups if needed. Maybe you could assess if maybe she has like a religion she follows or like a group. it's also important for socialization
Mhm.
and so that she feels that she's not
Not
alone.
alone.
Yeah.
That's true.
And then for the medication management, since she already had medications, she has this ibuprofen 400 milligrams, and then bisoprolol 5 milligrams, and then paracetamol. These are all for pain. Simvastatin. This is like for to prevent
Cholesterol.
cholesterol, and then the coagulation along with the aspirin and the
Yes.
enoxaparin sodium.
Mhm.
And then pantoprazole, this is like a stomach medication to prevent maybe regurgite reflux,
Mhm.
because since
Too much for treatment of acid.
yeah,
Yeah.
for the acid treatment.
Mhm.
And then we should encourage the follow-up care. If definitely there will be like a scheduled appointment for her to come back.
Yes.
We
Yes.
should encourage her to really go back, because
She should come back.
yeah, because there are times where patients after discharge they don't come back anymore.
Mm.
I think it has to do with the instruction the nurses give. We should give importance on why she should come back, so that we could check how is the wound healing. Does it need more care for, or what agent needs to be, what procedure needs to be done, or for example, if the surgical site has been healing well, or we have to do something about it because it got infected. So a follow-up is important, and then arrange for home health visits to monitor progress, and of course to provide the ongoing care.
Yes.
Yeah, definitely that's it. Do you have any other
Additional
additional?
information, not as of the moment. But
Yeah,
Yeah, it was clear
Mhm.
and yes, and organized.
as long as we emphasize on like giving her the instruction and the importance of
Mhm.
why she needs to do this and that.
Mhm.
I think that's also for the relative to encourage to be participative with
Yes.
the treatment,
So
the
we have
management.
Yes, that's right. So we have already tackled the assessment, the planning, and of course the
intervention.
interventions. Yes, so we can prevent the complications to happen, so the patient will be healed.
Yeah. I think that's it.
Yeah.
Okay, thank you so much.
Thank you so much.